All right. Hi, everyone. My name is Josh Brown, and today I'm going to be sharing my experience navigating the COVID pandemic with the National Hispanic Medical Association. So, a quick overview on me. I am a member of the Iowa Air National Guard. I'm a third-year student at the University of Iowa College of Public Health. So, I got to work with the National Hispanic Medical Association through the Washington Center. The Washington Center's VET initiative, which is specifically tailored towards veterans and making sure that their skills from the military transfer over to their civilian careers. So I got to work with NHMA through a 10-week session as a health policy intern. Unfortunately, that was also during the same time as the COVID-19 pandemic. So I was not able to go to DC. I included a nice little picture of the Capitol. That's where I would be if I had been able to go. So I got called up by my unit, the 132nd Wing, to work with the Unclassified Processing, Analysis, and Dissemination Unit. So what I was doing there is me and my team were processing and analyzing and synthesizing data coming directly from hospitals and COVID-19 testing data. So kind of my daily duties at NHMA, sometimes it would just be administrative duties, verifying spreadsheets. Other times it would be attending congressional hearings that really started to talk about identifying which populations were affected by the COVID-19 pandemic and talking about how COVID-19 really capitalized on the social structures and social injustices that were pre-existing before the pandemic. So a really big thing that I got to do with NHMA was I was working as an intern while also serving with the Iowa Air National Guard with the UPAD. So things had definitely changed a lot, but I was able to use the information that I was getting from NHMA to help guide decision makers through Iowa's COVID-19 response. So my supervisor at NHMA had actually asked me to compile information about which populations were most susceptible to COVID-19, how the pandemic was disproportionately affecting people of color and people who lived in long-term care facilities. And I actually got to use that information when I went into work later that day with the UPAD. I was analyzing testing data and case numbers, and I noticed there were some counties that had low case numbers but high positivity rates and limited amounts of testing. After some further analysis through US Census data, I found the counties that I was really concerned about, including Tama County, were primarily made up of people of color and had a high density of residents in long-term care facilities and a high density of long-term care facilities. They also had limited access to hospitals, and there were also meat processing plants in the county. Days before is when really all those outbreaks were identified in meat processing plants across the state of Iowa. So at the time, the nearest testing site had been 30 miles away and there were no hospitals in the county. But because of what I had learned from NHMA and what I was doing with my internship, I was actually able to apply that information directly to the work I was doing. And I was able to identify that most of the county I was concerned about, Tama County, was at extremely high risk for COVID-19. So I went ahead and called my commander at Joint Forces Headquarters and expressed my kind of concerns about the limited testing and the number of high-risk Iowans in the area. And I convinced them to work with the Iowa Department of Public Health, IDPH, to increase testing in the county. And that's where you see this news clipping, this screenshot of the news article where we're deploying COVID-19 testing strike teams to Tama County long-term care facilities. Shortly following that, my team and I collected enough data to convince both Governor Reynolds and leadership at Joint Force Headquarters to increase testing in specific areas. That's when you really started to see increased coverage of testing. So more areas had testing within the 30-mile radius. As far as my experience, my prior experience, I did some coursework through the university for my undergraduate credit. So I took the US health systems in a global context, which helped me understand the US health system a little bit more, but I wasn't sure how non-government organizations and nonprofits really came into the picture. Additionally, I had a lot of volunteer work under my belt. I regularly work with United Way of Johnson and Washington counties to kind of help serve underserved communities, which is something that I'm extremely passionate about. As far as my accomplishments, I think a big one for me was absolutely the Tama County long-term care COVID-19 testing and the increased access to COVID-19 testing sites across Iowa. Additionally, I worked with the National Hispanic Health Foundation on their vaping cessation campaign. Kind of moving forward, this experience was very different than what I had initially anticipated when I thought I was going to be spending 10 weeks in Washington, D.C., attending congressional briefings in person. I was really deflated when I found out that it was going to be online, but I actually did learn a lot while even through this kind of virtual internship. I think something that was really cool was NHMA also learned from me. They hadn't had virtual interns before, so I was able to help them work through what kind of things they could be providing me and how I could help with them. I also learned how to navigate a workspace in a virtual setting and how vital non-government organizations are in public health and public policy. But I think the greatest thing is I made some really long-lasting connections with people in Washington, D.C. Just some quick acknowledgements. I'd like to thank Ben Milano, my supervisor at NHMA, Vito Garrity, and the Washington Center's Vet Initiative programming team for this wonderful opportunity. Thank you so much for your time.